everyone. My name is Sarah Lubin, and I'm here with Dr. Leslie Ray Matthew, and thank you for tuning in with A Minute with Dr. Matthews. Our usual host, Fonz, isn't here today, so I will be filling in, but thank you, Dr. Matthews, for being here with me today.
Thank you for having me.
So I have some questions for you. Our first question is, what are your thoughts on the federal government mandating the vaccine and now rescinding on the vaccine mandates?
Well, one of the first things I wish they would have done is had the Novavax vaccine out, which is not an mRNA vaccine, but is produced a traditional way. That way you could give people options on which vaccine they wanted to take. So I would have liked to see that, but they came out with the Novavax just recently. And that would have been probably the best way to handle the coronavirus pandemic, is have several different options of vaccines that you could take.
Okay. How do you feel about those who have already taken the vaccine because they were in fear of losing their jobs? What do you feel like steps they should take as far as keeping their health together if they did not take the vaccine?
Well, most people didn't have a choice. They lose your job, get put out of the military.
Right.
You can't eat here, you can't go there. So they didn't give people many options and stuff. And so most people still have families, they have rent and mortgages. And so you can understand why they went ahead and took the vaccine. So you can't blame them under those circumstances. So it was done under duress.
Right.
Or stress, or stressor was added to them to encourage them to take the vaccine. And so other things you can do is, like, vitamin D works really well. It strengthens your immune system. Eat a healthy diet, social distancing, hand hygiene. Research has shown that basically men only wash their hands 50% of the time when they go to the restroom, which is bad. I think women were a lot higher at 60% in terms of hand hygiene. And then in close proximity, in large spaces where you have large crowds, mask was an additional thing you could do. And drink plenty of water, and just exercise, basic things that you normally do to stay healthy.
Okay. Earlier we were talking off camera, we talked about the Nuremberg Code. Can you explain to the audience exactly what that is?
Okay. Well, during World War II, we all know that the Germans did some very evil, maniacal things that was told against humanity. They experimented on our Jewish brethren, illegal medical experiments in terms of just things like leaving people outdoors in the cold weather, see how long it took them to get frostbite or freeze to death. They used a lot of experimental drugs and medications on people without their consent or wishes. So after World War II, when they had the Nuremberg trials, they actually passed the Nuremberg Code, which stated that you cannot experiment or give people medications or other things without their express written consent. And there were 3 more other things that was in the Nuremberg Code. Basically gave people human rights in terms of what people can do to you or force you to take or do with your own body.
Okay. So with the Nuremberg Code, what is your take on the federal government interfering between patient and physician?
Well, I think any medical decision should be made by the patient and their physician. Obviously, being a physician, when I was working as a trauma surgeon, I did not like people trying to tell me what I should do with my own patients. And so, especially when I'm examining a patient, I'm there with them day in and day out, 7 days a week. I've operated on the patient. And so I think I had a better understanding of what was going on with these patients. It's like insurance companies would oftentimes tell you, we don't approve of this therapy or this treatment, when the standard therapy or standard treatment doesn't work for all patients. So some patients, you have to do different things based on their anatomy, their genetics, their previous medical histories. So you have somebody on the phone and hour, 1,000 miles away, trying to tell you, without a medical degree, basically trying to tell you how to manage your patients. So I'm a big advocate of patient-doctor confidentiality, patient-doctor decision-making.
All right. And my last question is, I know you mentioned some of the things that people can do is take vitamin D.
Mm-hmm.
What are some vitamin D myths that you would like to debunk, like certain foods that we can eat that can help us with vitamin D, things like that?
Okay, well, you cannot get enough vitamin D from your meals. Only 10% of your vitamin D comes from the meals. Most foods simply do not have any vitamin D in it at all. So some of the few foods that have vitamin D in it are the fatty fish like mackerel, salmon, tuna, mushrooms. And like I said, salmon only has like 400 international units in it, and the average person needs anywhere between 2 to 10,000 IUs a day. And then milk is supplemented with vitamin D, and a lot of Americans are lactose intolerant. You know, they get nausea, vomiting, abdominal pain, and diarrhea when they drink milk. So you have to ask yourself the question, why would the federal government put vitamin D in milk when most people can't drink milk? So basically, you need to either supplement or get a lot of sun during the summer and early into the spring months in order to make adequate vitamin D. 90% of the vitamin D comes from the sun striking your skin, sending that compound to your liver and then to your kidney to make vitamin D.
Okay, well, thank you for all this
Thank you.
information, Dr. Matthews. If those watching, if you have any questions that you would like to send out for Dr. Matthews for his next episode on A Minute with Dr. Matthews, please feel free to send us a message and we'll be sure to make sure we can get you the answer to those questions for them, right? Well, thank you for being here. Thank you for watching. And this is A Minute with Dr. Matthews. I'm Sarah Lubin, and this, of course, is Dr. Leslie Ray Matthews. Bye.